Some say the nation didn't have much before, but what was available took better care of the population then than what obtains now. According to a professor in obstetrics and gynecology at the Lagos University Teaching Hospital, the growing numbers of people are too many for resources, stretched almost to breaking point.
The population has increased far more than the facilities have increased. So even though there has been an increase in the number of facilities, it's as if nothing is happening. And you will see, if you investigate, by going to public hospitals, very long waiting times, overworked health services staff, often health services staff with inappropriate behavior, partly based on lack of training.
Although the nation won the war against Ebola and is well on its way to being declared polio-free, all parties involved in the health sector agree that more funding is needed for infrastructure and equipment.
The funding for the health sector right from the onset has never been adequate. Majorly, all they just do is to pay salaries of staff, and there is always no money for research. And what we need to do now is research and development. What is lacking majorly now is infrastructures and laboratory equipment.
Even looking at the budgetary allocation to health from time immemorial, it has never met WHO minimum requirements, which says it should be minimum of 15% of national budget.
Experts also say for Nigeria to make faster and more meaningful progress health-wise, the nation must strengthen primary health care and have a more reliable statistical report.
How come that most of the tertiary health institutions, even we have most of the cases they treat their average of malaria, where the primary health center should pick or secondary facility, health facility should look at. Human resources there, they don't work together. And if the people who are trained to work there don't work together, it's an issue. How do you harvest the labors of the various personnel?
I will start with putting in place a proper statistics system for the country. If you don't have the statistics of your country, you are like probing in the dark. You strengthen primary health care because that is the mechanism with which you can bring health to the common man. Federal government must negotiate properly. It must back up those it says should go and represent it. When you are correcting anything within the health system or education system, you must automatically vary the ones of all those that are lower or higher than the person you are moving.
We expect our government to be able to put in place at least a P3 lab, a certain level 3 lab for Nigeria, so that we'll be able to isolate and culture some of these viruses.
Perhaps it would be instructive to look at the areas where the country has made progress, go back to the things that were done to achieve those successes, and apply the same principles to alien sectors. Mary Alale Yusuf, Channels Television News.